I'm Kristen Reynolds. I'm a family and integrative medicine physician with Aurora Healthcare. And before I get started, I just kind of want to get a feel for who all of you are. So those of you who are not in a healthcare profession, could you raise your hand, please? Awesome. Okay. And then those of you who, any physicians in the room? Oh, great. MDs, DOs, excellent. So a few advanced practice practitioners, yay. And nurses, occupational therapy, speech therapy, any other of the allied health professions, counseling, excellent. Wow, so a really nice mix. Good. Well, thank you for having me. Thank you for being here. This is a great conference, so it's really an honor for me to be here today. I always start with a bit of a story. These are my daughters, Annie and Mabel, and they were, I know I can't get away from this picture. They're like, 7.5, this is and they're like 3 here, but they're way older now. Like, can't you get over this, Mom? Like, they've grown up, But the story goes, when they were both 15 months, we were outside in the backyard. It was July, it was hot. They were in their diapers. We had a little kiddie pool. And my mom picked Annie up and put her in the wading pool, and she took her hands off, and there were pink fingerprints on Annie's torso. I said, Mom, what's on your hands? And within about 60 seconds, Annie had hives head to toe. And then we realized my mom had just eaten a peanut butter sandwich. And that was our first entry into the world of allergies. Subsequent testing revealed not only allergies to nuts, but to gluten, corn, dairy, eggs, and soy. And the recommendation from the pediatrician was to remove those foods, and I did. And since I had 2 kids and 4 of us in the family, I just said I can't really cook 2 meals, so you guys all get to do this. And within 4 days, I had 2 completely different children. So the eczema that they had struggled with throughout infancy resolved and has never returned unless we kind of go off diet. And even more striking than that was that behaviorally they were 2 completely different children. I did not think I had behavior issues. I just thought I have twins and this is really hard. But behaviorally they were different. They were happier. They were something changed in those 4 days. And it was about that same time that I went to an integrative medicine conference in Madison put on by Dave Rakel, who's been a real mentor for me, and I'd like to thank him in advance for some of his slides that are actually in my talk. And I learned at that conference that gut health is intricately linked with systemic health, that there's a really big link between how healthy your gut is and everything else. And disrupted gut health, actually about 70% of your immune system lies in your gut. And when your gut is messed up, you can see how that would affect your immune system and why that might cause eczema, allergies, those types of things in kids. And it can cause a whole host of other things, and we'll talk about some of those today. So at that point, I really made that kind of, I've always been interested in nutrition, and I love food, and I'm interested in health and prevention and wellness, but it was really, that was a tipping point for me that really impressed upon me the healing properties of food and the harming properties of certain foods too, if certain foods are not right for a certain individual. And I think as we go into the future, you're going to see a lot more of this individualized medicine, where we're really looking at genetic makeup and people's body types to determine what type of diet is best for people, because not any one diet is right for every single person. So today, I hope that by the end of this talk, you'll recognize that celiac disease and gluten sensitivity are quite common. Understand that celiac disease and gluten sensitivity affect more than just the gut and increase the risk for long-term systemic health consequences. Recognize symptoms of celiac disease and gluten sensitivity, understand the limitations of the currently available tests, and learn how to improve your health with gluten-free whole foods. So celiac disease is interesting. It, by definition, is an autoimmune disease triggered in genetically susceptible individuals by the ingestion of gluten, proteins in wheat, barley, and rye. And the diagnosis of that historically has been based upon a biopsy of the small intestine, showing the little fingers in the small intestine kind of shriveling up, what we call atrophy or death of some of those cells in the gut. Gluten sensitivity has been described in the literature in the past as elevated serum antibodies or these laboratory markers without a positive biopsy to confirm celiac disease. And it's been thought for some time that perhaps it's part of the spectrum. Maybe it's something like this iceberg theory where, the iceberg is the tip of what you see. You know, those people who actually have the abnormal biopsy and get the diagnosis are what we see, but underneath there are a lot of other people in the world suffering because they have undiagnosed celiac disease, and maybe gluten sensitivity might be a part of that. Interestingly, science over the past 3 to 5 years has actually suggested that gluten sensitivity and celiac disease might be two completely separate entities. Gluten sensitivity is activated more by the innate immune system, whereas celiac disease is activated through the adaptive immune system. You don't need to know what that means. It's just two different arms of the immune system. But studies are starting to suggest that maybe they're two different things. But what I hope to impress upon you today is that even though on a pathologic basis we might be seeing them as two different entities, the etiology is very similar. The ingestion of gluten in genetically susceptible people, and the treatment is very similar. So if there are naysayers out there, or if you feel you need to convince your doctor that gluten sensitivity is a real thing, there have been several studies that have come out over the past few years that gluten sensitivity is real. And this comes from the American Journal of Gastroenterology. This was July 2012, and this is kind of the Bible of GI, the GI world, basically showing what they called non-celiac wheat sensitivity, and now I see it referred to in the literature much more commonly as non-celiac gluten sensitivity. And they say this is a real thing, and it is something probably separate from true wheat allergy, which, you know, when people have a true allergy, it's kind of the IgE part of the immune system, where you get hives and anaphylaxis and that type of thing. So separate from that, but with characteristics similar to celiac disease. So celiac disease in and of itself has changed over the past 10, 20, maybe even 50 years. When I went to medical school, the dogma was, you know, the young child who was having failure to thrive, not gaining weight, diarrhea, malabsorptive type of issues. That is becoming less common. It's actually more common now for patients to be overweight or obese at presentation with celiac disease. And we see a lot of other symptoms or diagnoses at presentation, such as anemia, osteoporosis. Peripheral neuropathy, numbness or tingling in the hands or the feet, is actually one of the most common diagnoses. IBS, irritable bowel syndrome, dyspepsia, which is gut stuff. Neuropsychiatric disorders, we now think that neuropsychiatric disorders, depression, insomnia, anxiety, are actually more common than gut issues in people with celiac disease. It's fascinating. And some people have argued that, you know, when celiac disease, when we first started making the criteria for it back in, 40s or 50s, you know, they went down the esophagus with a scope and took the biopsy and said, oh, you know, this biopsy of the gut looks different than in normal people, and so we're going to call celiac disease this. You know, we're going to say it's because of this gut disruption. Some people have said, well, you know, if we had the technology at the time and we were able to go up through the carotid arteries and take a little biopsy of your brain, we might have actually called celiac disease a disease of the brain, because it really does affect that. There are also asymptomatic high-risk groups, so first-degree family members of people with celiac should be screened. Anyone with an autoimmune disorder, in my opinion, should be off of gluten, and that includes most thyroid disorders. And Down syndrome and type 1 diabetes also have a higher incidence of celiac disease. So I'm just going to go back to that for a second here. So this was from the Journal of the American Medical Association in 2009. Basically, again, you can see that I highlighted there that the neuropsychiatric disorders are really a big part of celiac disease. This is also a consensus statement that is aiming to redefine or to change, to reclassify how we define celiac disease. And now they're saying, you know, we really don't have to have that gut biopsy, and they're calling it a 4 out of 5 rule. And so they're basically saying if someone has a clinical presentation consistent with this, if somebody has elevated serum antibodies, so the labs are abnormal, if symptoms improve on a gluten-free diet, or if somebody has the high-risk genetic profile, those 4 things in combination can give you a diagnosis of celiac disease without an abnormal biopsy. Prevalence of celiac disease is about 1 in 100. Not too long ago, it was less than 1 in 10,000. We've had a 4-fold increase in the prevalence in the last 50 years. And in Finland, they had a doubling from the late 70s to 2000, and it was truly a doubling. It wasn't due to increased detection, because they had blood samples that they went back and checked, and it was not an increased detection. It was actually a true doubling. And so celiac disease, 1 in 100. Gluten sensitivity is thought in some studies to be as high as 1 in 10. I usually tell people 1 in 10 to 1 in 30 for the prevalence of celiac disease. Less than 5% of celiac disease cases are actually diagnosed. Why is this? Physicians think celiac disease is rare. When I went through my training, it was something we read about and we never saw again. So they don't think about it. Physicians aren't aware that a lot of people present without gastrointestinal symptoms. Some people might be using the older anti-gliadin antibody testing, but for the most part, what I've seen from most conventional labs in Milwaukee is that they're using the newer one, so that's good. GI docs don't always get an intestinal biopsy, and even if they do, celiac disease can be patchy. So it's sort of a blind biopsy, because you can't see it grossly. This is microscopic changes, so the biopsy might not hit the patch where celiac disease is affecting. Sadly, the gap between onset of symptoms and diagnosis is 11 years. So these people really suffer for a long time. What's wrong with gluten, right? It's the bread of life. I mean, from biblical times, we have a real deep emotional connection with bread. The history of wheat. Jay Braley wrote the book Dangerous Grains. I think he has an updated version that's out now. But it's interesting that humans and our ancestors have eaten fish, meat, organs, vegetables, and fruit for 1 to 2.5 million years. And humans have really only been eating grains for about 12,000 years, which, from an evolutionary standpoint, that's about 0.5% of our evolutionary history. So grains are a relatively new thing. Why the increase with gluten sensitivity and celiac disease? The gluten content of wheat is 50 times greater than it was 50 years ago, and part of that is through genetic modification. They didn't call it genetic modification at the time, so nobody will say that's actually what it was, but that's what they were doing. And putting more gluten in wheat makes the bread gooier and tastes better, and it sells better. We do have a society built on weak digestion, and we have an overabundance of convenient and processed foods. So gluten, what is it? It's the gummy substance produced during the processing of gluten-containing grains, including wheat, barley, and rye, and ancient grains of spelt and triticale, and maybe oats. If you're going to be eating oats, if you need to be gluten-free and you're going to eat oats, you need to make sure that they're certified gluten-free because there can be cross-contamination. And some people just who don't tolerate gluten also don't tolerate oats. We have an evolving GI environment. We eat on the run, which is stressful to our body. We have a lot of new proteins that we're exposed to, wheat being one of them, and dairy, mainly the pasteurization of dairy, is a relatively new thing in the last couple hundred years. We have a lot more sugar, and we have less nutrient-dense foods in our diet. We're exposed to different bacteria and maybe even less bacteria. If anybody's had a baby or a C-section and you've been in a hospital, you know how sterile things are, and it's actually that birth process is a really important part of inoculating an infant's gut with healthy bacteria. And we've kind of messed with that a little bit in some ways. We eat less fiber, and we have more prescriptions. So certain prescription medications can actually affect our gut adversely. Acid blockers, Zantac and Protonix, the purple pill, omeprazole, Prilosec might be a common one you've heard of, block the acid. And there's a reason that our stomach was made to be acidic, and so that really messes with things. Steroids and antibiotics can also mess with the health of the gut. So there are three main modes of defense within the gut. There's this mucus barrier, the microflora, which is that healthy bacteria, and then the local immune system. Remember I said about 70% of your immune system lies within the gut, and that's called the GALT, or the gastric-associated lymph tissue. You can see up there all the different things that affect these three really important modes of defense in our gut. And if you notice, there's one common theme to all three, and that's stress. And we all have stress in our lives. And lives have continued to get more stressful, and so how can we as individuals and as a community address that, because it definitely affects our health. So I want to talk just a little bit about a healthy gut. So you can see this is a picture meant to represent the enterocytes, or the cells that line your gut. And you can see that they're butted up against one another really tightly. There are no gaps or junctions. And there's these nice healthy little fingers, which are called villi, and those are important for absorption of nutrients, and that's where all the healthy bacteria lie, and there's that mucus barrier in there. Now, certain things can cause that to break down and turn it into what we call a leaky gut. And those are some of the things that I mentioned in those previous slides. So stress can do it, certain foods if you're sensitive to them, certain medications. And so you can see in this picture that the cells that were nice and tightly butted up against one another have kind of shriveled away a little bit, and now you see these gaps. And the fingers, the little villi, have decreased. So we kind of have gone from what I would call a shag carpet to a Berber carpet, right? Okay, so if you can kind of visualize that, we've changed that lining of the gut, and that really changes our ability to ward off disease and pathogens, and also our body's ability to assimilate nutrients. And these two slides, and this one came from Dave Rakel. So this one on the top of the horizontal line is meant to represent a healthy gut lining, and the bottom is meant to represent that leaky gut, that second picture. So you see on the top picture, the vertical lines are the enterocytes. Those are the cells lining your gut, and they're nice and tight against one another. And that star that's coming in, those stars are meant to represent a protein. This could be a dairy protein, casein. It could be gluten. Comes in, it should get broken down in the gut a little bit to smaller proteins or amino acids. Those are those little triangles that then get absorbed between the gut, the cells. And the body doesn't have a problem with that. The body uses it for energy and goes about its business. Now on the bottom of the horizontal line, that represents that leaky gut that I mentioned. And those cells are not nice and tight. There's gaps. That protein, that star, comes in and gets absorbed right through that leaky gut, goes right into the body, and then the body says, whoa, foreign, I don't recognize you, and it mounts an immune response, produces antibodies, and that in turn produces this cascade of inflammation throughout the body. So this is really how a local reaction within your gut affects health from your head to your toes. So this is how that affects systemic health. So, if you take the example of my daughters, when they were being exposed to some of these things they were allergic to, I imagine that star going right through and getting attacked by antibodies in this inflammatory response, and they had eczema all over. They were starting to develop asthma. That process has been halted since we've been able to heal their guts. Symptoms and presentation of celiac disease and gluten sensitivity, gastrointestinal symptoms can occur, and there's a few of them listed up there. Skin dermatitis herpetiformis is a skin condition that's basically equivalent to celiac disease. Liver problems, so elevated liver function tests, hepatitis. Nervous system, as I mentioned, neuropsychiatric disorders are really linked with celiac and gluten sensitivity. Bones, so anytime I see anybody with premature osteoporosis, so premenopausal osteoporosis, I want to be thinking, okay, is there celiac disease, gluten sensitivity going on here? Reproductive, I've seen a lot of people with fertility issues who end up getting screened for celiac disease, and lo and behold, they have that. And once you can heal that, eliminate gluten and heal the gut and quell that inflammatory response, they become fertile and get pregnant again. It can also affect male fertility. And then endocrine and autoimmune. So some of the ways that people might present before we know they have celiac or at the time of presentation would be with anemia, tiredness, fatigue is a real common one. Maybe kind of that foggy thinking, a little bit of just not being real clear in the thought process. Folate deficiency, which can cause elevated homocysteine, and that's a risk for various things. Calcium and vitamin D depletion, so osteoporosis. Selenium depletion, which is important for thyroid health, and then vitamin E deficiency can also play a part in the neurologic piece. So symptoms of celiac disease and gluten sensitivity, about 38% of patients are asymptomatic. And oftentimes people will go through the first 20, 30, 40 years of their life without anything much more than maybe a little bit of fatigue or some mild depression, maybe a little bit of insomnia or occasional gut issues, nothing really too striking. And then there's a trigger. So this could be an insult, such as an infection. I have a lot of people who say, you know what, I was healthy until I was 28 and I traveled to Europe for a semester or whatever and got food poisoning, came back and was never the same. And so it's affected that gut health. Surgery can do it, any trauma, so stress or childbirth can even do it. And then when you have that insult or that trauma, remember how we talked about stress affecting those 3 barriers to the gut health? So So that will compromise the gut lining, and that can lead to the inflammation that we talked about with the gluten peptides crossing into the bloodstream and the whole cascade. So problems that are linked with celiac disease and gluten sensitivity are many. I've alluded to many of these already. I'm afraid that your irritable bowel syndrome has progressed. You now have furious and vindictive bowel syndrome. So 40% of irritable bowel syndrome patients show improvement on a wheat-free diet. And there is actually a 4-fold increase in biopsy-proven celiac disease in IBS patients. And the United Kingdom now has guidelines for screening for celiac disease, and IBS is included on their guidelines. We should do that here as well. Who should be tested? Anyone with persistent GI symptoms, anyone with red flags. So like I said, osteopenia or osteoporosis, especially before menopause, unexplained iron deficiency anemia, unexplained liver abnormalities, any high-risk patient, and again, IBS, and finally, any immediate family members of somebody with celiac disease. So, how do you diagnose celiac disease? No single test has been universally accepted as the standard. Clinical suspicion is most important. Serum antibodies, so this is anti-gliadin, AGA, or tissue transglutaminase, TTA. So these are the serum markers that one would draw initially if you suspected celiac disease. And a small bowel biopsy traditionally has been the confirmatory next step. However, remember there's a new 4 out of 5 criteria. So I have had patients who have had a negative biopsy, and I've worked with the gastroenterologist, and I've said, hey, you know, I really think this person has celiac. Let's get genetic testing, and can we call it celiac if they hit 4 out of 5, and we do that. Capsule endoscopy is relatively new. I don't think that that's close to being a standard yet. Stool and salivary antibodies. I've used this some in working with patients. I think it can be helpful for people who just need a number. You know, they need something to say, you know, look, you have elevated antibodies in your saliva, but it hasn't really been validated scientifically across multiple studies, so it's not something that I can say with 100% certainty is worthwhile. And genetic testing, so HLA-DQ2 and DQ8 are the 2 high-risk genes for celiac disease. And then the 4 out of 5 rule, which we already talked about. So diagnosing it, clinical suspicion is most important. Consider labs. So even if I have a patient who I think, because I get a lot of celiac labs that are, and they're negative, but I still ask people to go off gluten because that's that gluten sensitivity picture where they don't necessarily have the markers yet, but they're exhibiting the symptoms. And I usually get baseline labs before asking someone to go gluten-free, only because if indeed they have celiac disease, I do monitor that a little bit differently than gluten sensitivity. There's a higher risk of gastric lymphomas, for instance, in people with celiac disease, and so I might want them to have a scope by a gastroenterologist periodically just to monitor for some of those concerning sequelae of celiac disease. Symptoms, if symptoms improve on a gluten-free diet, that is also diagnostic. However, know that it might take time. Many people can take 6 to 12 months or more to heal. Most people, in my opinion, feel better within 3-4 days, like my girls. They were 2 different children within 4 days. And they've healed from a lot of those other allergies, by the way. We still stay away from gluten like it's the plague, but and they still have peanut issues, but they're eating dairy now and eggs, and by healing their gut, we've actually healed a lot of those allergies. But it does take time. So treatment of celiac and gluten sensitivity, this is probably kind of I think the reason why many of you are probably here. So I think typically the advice you would get is eliminate gluten and you'll be good to go. But that's not the end of the story. So because you're at a nutrition conference, right? So there's got to be more to it than that. So gluten-free diet is important, but if you just go out and you buy a bunch of processed gluten-free foods, you're not going to feel any better. So I like to talk about a modified Mediterranean diet or a gluten-free whole foods diet. It's pretty easy to be gluten-free if you're eating whole foods, as long as you're not eating, bulgur wheat and rye and those type of things. But, healthy protein sources like grass-fed beef and fish and chicken and sweet potato fries and vegetables and healthy fats. These things are, all relatively easy to bring into the diet, it does take planning and it does take time to prepare these foods. It's not as easy as grabbing the bag of gluten-free pretzels when you're on the go, but people do feel better when they're eating a whole foods versus a processed foods diet. Healing the gut is really important, so eliminating anything that's disrupting the gut, whether that's other food sensitivities, toxins, adding in some supplements that might help to heal the gut, and then exercise and stress management is a key part. So a gluten-free diet, strict lifelong avoidance of gluten for anyone with gluten sensitivity and celiac disease. Now people ask me when they have gluten sensitivity, do I really have to go all out? Can I have it every now and then? Is that okay? And that's exactly the question my husband asked when our nutritionist said, when kids have issues with gluten, it usually comes from one or both parents. And then we had genetic testing, and we each have a high-risk celiac and a high-risk gluten sensitivity gene. And I said, well, I'm not willing to wait until I'm sick. I'm going to stop eating gluten now. My husband's response was, can I just decrease gluten a little bit? And our nutritionist's answer at the time, and this was before I knew a lot about gluten, was no, you really need to get rid of all of it. Even the tiniest amount, 1/8 the size of your thumbnail, is enough to induce that inflammatory response. So we had a little education that happened around that, and then he came on board, and now I think he's even almost more strict about it than I am in many ways. But we completely avoid gluten, our whole family. Like I mentioned before, oats are not recommended during the first year. There is cross-contamination in processing, and oats are really closely related to wheat. So modified Mediterranean diet, 5 meals per day, rich in protein, less carbs and grains, maybe more of the ancient grains like quinoa, amaranth, brown rice tend to be better options for people. Rainbow veggies, so leafy greens, cruciferous vegetables, whatever you can get your hands on for the non-starchy vegetables are really key for all those antioxidants and flavonoids. And then I often have my celiac and gluten sensitivity patients eliminate gluten, dairy for maybe a month or longer, depending, just because dairy is hard on the gut. One of the drawbacks to doing a gluten-free diet is that you don't get as much of that soluble fiber through the grains, and so I usually recommend to people to do some ground flaxseed to help increase that fiber content. So testing for and treating nutritional deficiencies, everyone with celiac disease should be tested for some of these nutrients, including iron and B12, vitamin D. DEXA, or bone mineral density testing at Diagnosis, is important. In children, the bone density will usually return to normal. In adults, it may not. The 5 R's of healing the gut, so just things to think about as you're thinking about healing your own gut. Removing whatever is upsetting your gut. So we talked about gluten as that would be an allergen. Infections, I alluded to. Pollutants and stress. Replacing things that might be missing. When the gut is messed up, it's not producing digestive enzymes, and so you might have to take some digestive enzymes for a short period of time. Reinoculate, so putting back in the healthy bacteria that might have been wiped out from whatever stress or antibiotics it was that might have initially triggered the gut stuff. Repairing the gut, so L-glutamine is a supplement that's the essential fuel for the enterocytes, or those cells lining the gut. Antioxidants and micronutrients through the modified Mediterranean diet, and then rebalance, restoring balance in life. Healing the gut, some supplements to consider: probiotics, vitamin D, L-glutamine, as I mentioned, fish oil. I did this with my girls, started at 18 months with them. There's some really interesting data out there. It's anti-inflammatory. You can probably get the same benefits from eating fish on a regular basis, but if you do want to use fish oil, you really want to get the molecularly distilled in a good brand. There's a lot of brands out there, but I don't usually recommend patients just go get the cheap stuff at Sam's Club or whatever. Vitamins and minerals. So, some people, the other thing to think about with a gluten-free diet is that now you're not eating some of those fortified foods. So the flours, cereals and pastas conventionally in our country are now fortified with folic acid and B vitamins. So just being aware that on a gluten-free diet, most gluten-free foods don't fortify in that way. So maybe a B complex for people who are on gluten-free diets. Avoiding acid suppression, avoiding dairy. Consider zinc, which is also helpful for healing the gut. Not in too high of doses, though, 20 to 25 milligrams a day, but it competes with copper, and so you want to be a little careful with too much zinc. And aloe vera juice can be quite healing for the gut. Additional considerations: work with a well-versed dietitian. Pay attention to non-food sources of gluten. So lipsticks, cosmetics, shampoo, conditioner. My girls weren't completely getting well after a year, and I went back to the nutritionist, and I just said, they're still kind of struggling with some allergy symptoms. And she said, have you looked at their hair care and skin products? And I looked at their Aveda shampoo, and the second ingredient was wheat protein. I mean, I had never even thought to look there, but the skin is our greatest organ of absorption, so we will absorb those things. Stamp and envelope adhesive, so tape your envelopes closed instead of licking them. Play-Doh, medicines and supplements. Sadly, the FDA does not regulate medicines for gluten. It's very hard to find out if medications contain gluten or not, so you have to do some deep digging on that one. I mentioned gluten-free foods are not fortified. And then as a word of caution, processed to remove gluten, we're not sure about that yet. So there are some beers on the market like Estrella Dora that comes from Spain, and they do some sort of processing to take out the gluten. That it might still be a problem in sensitive people. If you're going out to eat at a restaurant, and they say, oh yeah, the fries are fine, you want to say, do you have a dedicated fryer that does not have other breaded things in it that might contain gluten? Because again, that small amount of gluten can be a problem for people. Sushi rice, so sad, one of our favorite foods. My daughters love sushi. I just learned that sushi rice is often, they add wheat to the vinegar or something to make it stickier. So you want to ask if you're going out for sushi. And then Thanksgiving turkey. This is so sad. I just learned. Last week they had this Gluten Summit. Did anybody see the Gluten Summit? Yeah, it was really cool. So Tom O'Brien, who's a chiropractic doctor and is big into the gluten sensitivity world, put on a week-long summit with some of the leaders in celiac disease and gluten sensitivity internationally, and it was phenomenal. But I listened to this one webinar where they mentioned that turkey is often injected with broth, and they're not required to say where that broth came from, and the broth could have gluten in it. So for your Thanksgiving turkey, just little heads up there, you might want to look to see if there's broth injected. And this is pretty much my family at Thanksgiving. Can't have salt, lactose intolerant, vegetarian, vegan, macrobiotic, fanatic traditionalist, on a cleanse, ultra picky, allergic to gluten. I do not know how my mother-in-law does it, seriously. Grocery shopping, quick tips. Look for wheat on the allergy list on the label, because companies are required to list the top 8 allergens on the label. If wheat is there, you're done. You don't buy it. If wheat's not on the list, then you look in the ingredients for the following 6 items: wheat, rye, barley, malt, oats, and brewer's yeast. Brewer's yeast comes from beer, right? And there's gluten made in beer. So if those things are not there, you can pretty much be sure that's a gluten-free product. I said pretty much because there are some caveats to that. So do beware of hidden gluten, like I mentioned with the turkey and some of these things that like produce is, for whatever reason, monitored through the USDA and not the FDA, and the USDA doesn't have the same rules as FDA. It's very confusing. So I would recommend this website for any of you who have questions about gluten and eating a gluten-free diet. It's called GIG, or the Gluten Intolerance Group, and it's a support. It gives you links to local support groups, but it also is an educational resource. They have a ton of incredible information in there, and there's a great section in there for kids. I'm so excited because I'm always worried, like, my kids are different than everybody else. What are they going to do when it's, they're teenagers and it's time to go to camp? They actually have a camp here that's not a celiac or gluten camp, so it's not like all the weird kids go to this camp, but it's a camp for anybody. But they're very strict about the gluten-free piece. So they've got, 400 kids who are on regular diet, and then it's still, they've still got this capacity to have kids with allergies, which is really cool. They also have a certification process for restaurants. So, up until now, restaurants can just say, oh yeah, it's gluten-free, and you don't really know. I mean, you don't know how much these people know about it. And they actually went in, I think California Pizza Kitchen was the first to get this certification recently. They used to say they were gluten-free, and they really weren't. I mean, they were making their pizzas right next to the regular flour pizzas, and now they've got a dedicated area for their gluten-free stuff, and they've actually gotten rid of wheat flour in their facility at all. They use rice flour even for, preparing the pizza crust for the regular pizzas. So they've become much more strict and sensitive to that, and I think you'll see more restaurants doing that in the future. So I don't think I have time to go through this case. Let me do it real quick. I got 3 minutes, right? So a 69-year-old female came to me with a 25-year history of chronic daily headaches, fatigue, joint aches. The trigger was a trip to Europe where she had severe sleep deprivation 25 years ago. She's been worked up by multiple specialists, including a neurologist who diagnosed migraines. Her rheumatologist noted that she did have an elevated ANA, which is an anti-nuclear antibody. It's a screening test for lupus, but her confirmatory test for lupus was negative. So it sort of looked like she had some kind of red flags, but was basically told she had no autoimmune disease. But she came to see me. She said, I really don't feel well after I eat bread or wheat. She had depression, constipation, irritability, some eye issues. Her celiac labs were negative. Her vitamin D was extremely low at 33. B12 was very low. And so I advised that she do a gluten-free diet, and she opted to do so versus, going on and doing any more sort of like, endoscopy or looking at her gut or anything like that. She didn't want to do anything invasive. High dose vitamin D for about 6 to 8 weeks, and then rechecked it, and her vitamin D came up to 72. Put her on some probiotics, fish oil, B12 injections, and she got better. Her headaches went away, her mood improved, her fatigue improved, and her joint aches went away. I see this all the time. It's incredible. So celiac disease versus gluten sensitivity, they may be one in the same spectrum. They may be two different things. We don't really know, but ultimately they're two paths to the same result. And in summary, they're both common. They might present atypically. The long-term sequelae are severe. Simple lab tests are available to support the diagnosis, but the clinical picture is really important. And strict lifelong avoidance of gluten, along with healthy nutrition and supplements, can help to heal the gut and improve quality of life. So that's what I've got for you for today. Thank you for your time. I have maybe a couple minutes if I can take 2 questions. Yeah, go ahead.
Do you relate autism with a gluten-free diet?
Most people with autistic children, most parents will take them off of gluten and dairy and some of the top triggers, and they do see improvement. A lot of it is getting at the gut health as well. Yeah.
What is
Crohn's
Crohn's disease?
disease and is an inflammatory bowel condition. It's also autoimmune, and a lot of people with it is, but it also is inflammatory. So people will have the joint aches or the arthritis, and people with Crohn's do a lot better on a gluten-free diet. So again, that's one of those autoimmune diseases. Like I mentioned, there's a huge link with autoimmunity and gluten sensitivity. Couple more? Yeah. Yep, you. Mm-hmm.
What about fish oil? Is that from the omega-3?
Yep, that's the omega-3.
And then if you want to find other source for that, is chia seeds?
Yeah, so chia seeds and flax seeds do have omega-3s in them. The problem is that it's the ALA, the alpha-linolenic acid, which is a precursor to DHA and EPA. Only about 30% of people actually make that conversion very well metabolically in our bodies. So I think it's hard to get the amount of omega-3s through chia and flax. I still recommend taking those because they have a lot of other health benefits, but I do still think the fish oil omega-3 form is important. Yeah.
Do you think that going also grain-free, totally like no rice flour or anything like that, would help heal the gut more since that's so much sugar?
Yeah, it can. It depends on the person. So some people can tolerate some of the grains and, some of the brown rice and some of those ancient grains. Other people don't. So it's just, again, that's a great place where you can work with a dietitian or nutritionist who's well-versed in it to see. But, a trial off of grains and substituting maybe sweet potatoes or squash for that carb source, that's an option. Mm-hmm. Yep.
Have you ever worked with anyone with ALS and taken them off?
I haven't specifically, but if I had someone with ALS, that's one of the first things I would do. Yeah. Okay, so I want to thank you for coming. I often get a lot of people who come up afterwards and say, can I come see you? And I'd love to see each and every one of you in my practice. Unfortunately, my practice is closed, but I just want to let people know that I train residents at my clinic, and these are residents who are really interested in the stuff that we're doing today. And so that is an option to get in through seeing the residents. And basically, they see a patient, and then they come and they talk with me. We come up with an integrative treatment plan, and then we both go back in together. So I like to say it's 2 brains for the price of 1. So thank you all for being here, and have a wonderful day.